Deebo Samuel just had surgery to fix a Jones fracture in his foot. The reported timeline for his return was 12 to 16 weeks, but Samuel is saying he'll be back in 10, and the evidence tells us to agree with him. A recent study on results in NFL players with this injury and treatment showed that NFL athletes had an average return time of just under 9 weeks. And the most important point about this study is that it was co-authored by Dr. Robert Anderson, the same surgeon who performed Samuel's surgery today. That suggests that Samuel will probably be on a similar recovery protocol and that 10 weeks should not be an unrealistic target. That would put his return at about 2 weeks prior to the Week 1 kickoff. Data from 3 studies shows some mixed results on game participation after return to the field. Wide receivers did produce fewer fantasy points per game after injury than their peers, but the difference was not huge. Now, we've started to see some quotes that 50% of Jones fractures in NFL players have healing problems, but we consider that a bit misleading. In the study that this stat comes from, half the patients healed without complication, and 3/4 of the rest partially healed. The remaining 13% had minimal healing, and these players did tend to have lower game participation, but the same was not true for the partially healed group. Overall, if recovery goes smoothly, we're expecting Samuel to return in about 10 weeks from now, but there's some weak evidence to suggest mildly decreased short-term productivity when he comes back. He now will carry a moderately elevated long-term durability risk, but he can likely still return to form and enjoy a long career in front of him. As a result, we're downgrading him only slightly in drafts, mostly because we're not banking on him to pick up exactly where he left off from last season just yet.